Lacunar syndromes. So here we're going to focus on four more common. So pure motor hemiparesis. So looking at the pathology, the lacunar infarction in the posterior limb of the internal capsule. Lacunar infarction in the posterior limb of the internal capsule. Now the presentation of the pure motor hemiparesis. In case of presentation, there is unilateral motor deficit where the face, arm, and to an extent the leg as well, and there is mild dysarthria, and there is no sensory, visual, or higher cortical dysfunction. Next, we are going to focus on the pure sensory stroke. Here, in case of the pathology, there's stroke in the ventroposterolateral VPL, ventroposterolateral nucleus of the thalamus. Now, looking at the presentation, it includes the unilateral numbness, paresthesis, and hemisensory deficit. It involves the face, arm, trunk, and the leg. Next, we are going to look at the ataxic hemiparesis. Such a case, the pathology, there is lacunar infarction, and this is in the anterior limb of the internal capsule. Now looking at the presentation, in the presentation there is weakness, and it is more prominent in the lower extremity and along with the ipsilateral arm and leg incoordination. Lastly, looking at the dysarthria and the clumsy hand syndrome. So in such a case, the pathology, there is lacunar stroke, and this is to the at the basis pointers, and the presentation is there is hand weakness, there is mild motor aphasia, and there is no sensory abnormalities.